device company, and really excited to have him here today. They've got some cool opportunities around the U.S. and really, I'd love to start out with Andrew. Would you mind telling us a little bit about yourself, your background, and then Flosonics and what you guys are all about?
Yeah, good stuff. Thanks for the introduction, and I'm really pleased to learn about the program and be able to engage with all of you. So hopefully everyone learns a little bit about what we're working on today, and uh, start getting some transitioning members to come join our company. So just really quick, am I going to be able to share screen? Is that helpful for the?
Yep,
I had some slides if it's
absolutely.
helpful.
Yeah, absolutely.
Good stuff. Let me kick it up here. And maybe I don't know if it's possible. It looks like there's quite a few people on the call, but we're a medical device company, and so the primary I think roles that we at least have in the short term are more clinical, medical, nursing type focused positions, and then in the future maybe more some operational logistics type of things as we roll out our technology into hospitals. Lots of things to do when launching a new technology in a hospital in terms of logistics, coordination, growing team across the US. So really quickly here, know when you've got me live.
Yep. We've got a few students on the call that are in healthcare IT. We've got a physician's assistant. So we
Oh,
got a few,
perfect. Yeah.
yeah, we got a few folks in the healthcare industry. So
Yeah, all great stuff. So we're a company that's we've been commercial for a number of years now. We've developed this technology over the last 10 years. We're across the US, across 30 hospitals currently, and expanding that with active partnerships with multiple branches of the DoD. How I came to learn about the SkillBridge program is actually through some of our DoD collaborations and some of the partners we work with that have had success hiring out of that SkillBridge program. So really excited to leverage this great mechanism and hopefully tell you more about what we're doing. So what we've developed is the world's first wireless wearable blood flow sensor. And if you're looking at my screen, if you can see me here, it's about the size of an iWatch face. And the beauty about this is that it makes measuring blood flow fast, easy, and simple for anybody who needs to measure it for a whole host of different reasons. So with respect to our DoD partnerships, those are mostly centered around trauma triage, combat casualty care, being able to get a quick assessment on someone if they're likely to decompensate, and then monitor their en-route care and ultimately through definitive care. In the hospital, the way we use this is to help guide fluid resuscitation for patients who have sepsis, post-operative hypotension. And so there's a whole bunch of different use applications clinically on why you would want to measure and monitor blood flow, but they're hard to do, cumbersome, technically challenging. So we're kind of putting this really complex technical workflow that used to only be available to highly trained ultrasound users, putting it in the hands of nurses that are able to do these assessments much more frequently and help make better decisions for their patients. So we're the only technology in the world that can do this.
that's incredible.
And so what that looks like kind of on a patient here is you have a patient who arrives, you place a flow patch over the neck as an adhesive, wirelessly transmit blood flow monitor data to an iPad, and we automatically quantify how it's changing to help manage that patient. In 2024, we were awarded Digital Health Awards winner for Best Provider Diagnostic Device. So we're internationally recognized as a really novel and new technology. We've got over 45 scientific publications, and as I mentioned, we have active DoD collaborations with the Air Force, Navy, and the Army for a variety of different clinical use cases, specifically in burn resuscitation, trauma, and pre-hospital EMS care. And we are also internationally recognized through a partnership with NATO as one of the innovative technologies that went through their Defense Accelerator program this past year. Across the US, some key mark institutions have been adopting and using FlowPatch since we launched. Up on the screen is just a number of customers that we're currently selling into and implementing into, and our goal is to expand that across the US and continue to grow, which is why we're here today, to hire really talented clinicians to come join our mission and improve patient care. including the one of those customers, including is the DoD. So we are sorry, the Department of VA rather, VA hospitals. We're in a number of VA facilities now. And so just to tell you a little bit about the main opportunities that we're currently looking to fill in the short term with respect to the SkillBridge program, we're looking for people who have clinical training. So, it could be any nurse, PA, medic, corpsman, looking to come in and help introduce our technology, launch accounts, train users, how to use our device, implement it into the care pathway, and support nurses and doctors to learn how to use this new technology in hospitals that have adopted our device. We've got a commercial team. We've got about 15 of these types of positions already on the team. We expect to add another 5 to 10 in the next 6 to 12 months across the country. We don't have a specific geographic requirement at this point, more regionally focused. So major metropolitan areas are kind of like where we're targeting for expanding our hospitals. So for example, if we were thinking about a Texas region, anybody within striking distance to most of the hospitals. Same thing with Florida, California, Northeast, Midwest, Chicagoland, all open places to do business for us. So we're excited to expand the team. Sure, Tyler. I mean, I think that pretty well covers the gist of what I was hoping to get through today. I know we've got a lot more time. I'm happy to open it up to questions, or if you had anything else you wanted me to cover, I'd be happy to.
Yeah, absolutely. I think what would be great is if some of the folks that are interested in healthcare on the call, as they transition out of the military, if you guys have some questions for Andrew, I definitely recommend taking the opportunity, especially someone in his position, in the medical field, to pick his brain on whatever you guys got and ask him about Flosonics, ask him about their technology, ask them about the roles that they're looking to fill, and take the opportunity. Don't let this one pass you up.
Yeah,
Joseph.
it's a great, Tyler. Great. Sorry, Joseph. Really quickly, just to add a couple points to that. Importantly, we are a dual use technology, and so all of the places our technology helps patients is true for military and military health as well as it is for civilians. So I think of interest to the group here, we are a dual use technology. So that's one important point. And I just want to maybe just give a shout out. We do have a job posting up on the new job board, and we encourage anybody to apply through that job board. Through our profile there, you can also find all of these jobs posted on our website, LinkedIn, really anywhere. But we've got a job up on the internal job board for 7 Eagle, and my contact info is there as well. So any number of ways to get at us, please don't hesitate.
Joseph, what question you got, brother?
Morning. The question, or I actually have a couple questions. That's fine. I see that you're based out of Canada. Is that correct?
We're Canada, US. Yeah, we have US entity and a Canadian entity. Yeah.
Okay, perfect.
Yeah, we have about 25 US employees across the country.
Excellent. Currently, what are the markets that you're biggest in right now? I know you mentioned California, which is where I'm at. And you said there are opportunities here. What entities do you already have here already?
If you're looking at the screen, Sutter Health is one of the largest integrated delivery networks in Northern California.
Okay, so right now, mainly this product itself, which it seems like the job is revolving around the flow patch. Currently, where are you at with it within the US? Where is it mostly being used?
We're in 30 hospitals across the US. We're used the hospital, the largest number of hospitals in a given network would be Sutter currently in Northern California, Southern California, New York City, Mount Sinai, and multiple VA facilities in the Midwest. And we're actively launching a handful of accounts in the Carolinas currently as well.
Fantastic. I'm definitely interested in looking into some of the studies. I'm a PA by a physician assistant by trade,
Cool.
and this does pique a little interest on my part, or a lot of interest, I should say. So I'd love to see the studies on it and love to see where it's going. So I'll
Yeah,
probably
absolutely. I
be
mean,
reaching out.
important to note that the technology is validated, FDA cleared, and sort of the studies on it is really around using stroke volume guided um, assessments to ensure that the fluids that you're going to deliver during fluid resuscitation, specifically in sepsis, septic shock, are going to be helpful and not harmful to the patient. So really the problem that we're aiming to help with clinically, and where all of our pretty well all of our customers, our primary call point, is in the sepsis care pathway. These are patients who are hypotensive. They are going to get fluids, and those fluids are likely to harm them if they can't handle those fluids. So we help, really our customers. We ultimately implement FlowPatch as a technology-enabled solution within a care pathway. And so you imagine if you've got a sepsis patient who comes in, a sepsis alert is called, they're going to get the sepsis bundle applied to those patients. Our device kind of goes along with that patient and really helps optimize the care coordination delivery between the ED, ICU, and optimize for fluid resuscitation, but also helps when to fork that decision to the ICU and move over to vasoactive medications if fluids are no longer considered to be safe based on the patient in front of you. So that's the core value prop that we're anchoring on for most of our customers. And now we have a number of other customers that are also using us. Mount Sinai in New York City has launched us in their transplant and surgical ICU post-operatively to help manage hypotension and guide fluid resuscitation. Those would be kind of the primary use cases. And ED, ICU, step-down unit. So multiple departments within hospitals launching it, as well as sepsis emergency response, sepsis rapid response teams, depending on the institution, their culture, and their initiatives.
So I love anything that shows that it can improve morbidity and mortality. And I'm excited to read more about this after class today. So
Yeah,
thank you
sounds
very
good.
much.
Yep.
And then like the album refill. Ashley, do you have a question?
And sorry, Joseph, where are you located? Are you NorCal, SoCal?
SoCal.
Okay, cool.
Hi, sir. Good morning to you. How are you? I loved his questions that he asked, by the way. So my background is medical administration, but I've worked in the ICU, step-down units, pediatric anesthesia. I had a lengthy career at William Bowman Army Medical Center and the Cleveland Clinic. Have you ever thought about sourcing your products to the Cleveland Clinic?
Absolutely. Yeah, we currently are going through the process right now to do an evaluation with Cleveland Clinic. Yeah.
Okay. Yeah. So I am interested as well. I've sold medical insurance. I've sold life insurance. I've never got into being into medical devices, but this is actually interesting because I just remember cases that I've seen in the ICUs and things like that. What would you say as far as like credentialing for this type of job? Like, because my goal is basically my degree is in social work. It's going to be in social work this next year and a half. Would you say that this would be a good opportunity for someone who may be moving around the military still? Because my fiance is active duty as well. I'm getting out. Would this be a job that I could take with me as I move around the world still? A career?
Move around the US or move around the world?
Both.
It's a good question. I think the primary positions that we're looking to fill in the short term would require, we're looking for people to be on site, training and working with launching new customers and new hospitals.
Right.
Future opportunities could be available with sale on the sales side, targeting maybe more business development type opportunities, if that could be something that could be done remotely.
Wow. Okay.
So if it sounds like I'm trying to piece the puzzles
Yeah,
together
you're good.
as we're on the fly here. But, based on what you told me, you have a great understanding of how these places work, who the stakeholders
Yes.
are, how to try and identify who those, important players are in a given, say, for example, the emergency department or the ICU,
Yes, sir.
who and how those decisions get coordinated, who needs to get lined up, and ultimately help try and bring all of those pieces together as we align stakeholders on the value proposition, but then try and make the sale and ultimately bring a new technology. And I'm sure you can appreciate is a ton of work.
Yeah. Yes, sir.
So
No,
if
thank
that
you.
sounds of interest, we'd love to have a chat and learn more
It
about your
does.
backgrounds. And it's something we've been thinking a lot more about recently in terms of how do we target and line up the pieces in terms of, a good example. Sorry not to go into too much detail here, Tyler, but when you get on GPO with a given hospital network, how do we get in front of the right people at those different sites, and how do we plan
Right.
to grow within a given IDN? So if Cleveland Clinic was the example you used, what's our entry point? How do we expand? Who are the key stakeholders? How do we get Cleveland Clinic to adopt our technology more across their system? What data would they need to see? What committees exist? So, just to multiply that across 5,000 hospitals in the US.
You got it. I'm interested, sir. I will be in touch. This is awesome. Thank you for what you
Cool.
do.
Yeah, thank you. Appreciate the interest.
Hey, Ashley, if you go to our job board on 7Eagle, they actually have a job posted on there. And as long as your profile is complete with a picture, resume, and all your information, you can just one-click apply. And then Andrew will gain access to your resume, your phone number,
Oh,
email, all
okay.
that stuff as well. So,
Okay, I'm gonna do that today. Thank you.
yep, absolutely. Was it Michelle? Did you have a question? I thought it was you that had your hand up. I could be wrong.
No, I didn't have a question.
There was somebody that had their hand up just a minute ago. I'm not sure who it was, but
Quick thought to add in. You were speaking of Cleveland Clinic, and she was talking about overseas. We do have a lot of Cleveland clinics overseas, especially when we're deployed in places like UAE, some of the other surrounding nations around there. That might be a possibility. Just throwing that out there for her.
Yeah, there's one in London too.
awesome.
Yeah, maybe in the future for us, we're focused on the US right now, just with the international complexities of bringing medical devices to different countries. So we're focused on the US civilian market and the DHA DoD partnerships that we've got.
Good stuff, though. Isaiah, you got a question?
Yes, sir. Can you hear me okay?
Yep.
Hi. So yeah, I have a 6 years of healthcare administration, but mainly I've been doing IT within the hospitals. So I have my bachelor's in healthcare administration. I just kind of want to see if there's like roles or benefit for IT, job opportunities within your what you're doing here. Because I'm in the Carolinas. I'm in South Carolina. I just want to see what opportunities may be surfacing for that type of specialty.
Thank you for the question inquiry. As we get more customers, the potential future opportunity really kind of lies around doing kind of cybersecurity risk assessments with vendors. That's a big one that comes up a lot. So, every medical device that's going to bring a new technology into the hospital is subject to an IT vendor cyber risk assessment. Those are, the more of those that we have would necessitate a more dedicated resource. Currently, we don't have an opening for that, but that would be the primary piece. And then in the future, if and when customers do start to do EHR integrations, that could be the kind of the next opportunity. But unfortunately, we currently don't have any postings for that. But if they were to come, that would be the spot, I think.
Awesome. Thank you.
I saw one question in the chat a little bit ago, Andrew. It said, "Do you have any availability in Las Vegas?"
Availability in
So
terms of
could
like
someone, yeah, like could someone live in Las Vegas and
Yeah.
work with
Yeah.
Flosonics?
Yeah, I mean, the important note of this at least the primary job that I was alluding to throughout this call is depending on where our customers are and when the main job is to go to customers and launch those sites, that typically takes, enough travel time. So, if, for example, if the person resided in Las Vegas and we were launching an account in Denver, or we were launching an account in LA, there would be travel, to the sites, to the hospitals, to go there and train and do those things. If we had hospitals in Vegas, awesome. But there's a large travel component to and as we get more sites, more hospitals, the travel geography coverage is getting smaller and smaller. So for example, the NorCal opportunity or SoCal opportunities are much more dense in terms of number of opportunities within a small distance. Whereas, say, for example, maybe it's more spread out across the Midwest currently. And as we get more customers and more demand, we'll narrow down the travel. So
awesome. Maria, what's your question?
Hey, Tyler, it was me that had my hand up earlier, but I'm driving, so it's a little precarious right now.
That's
so
okay.
my question is, I know that you said that you're looking for somebody that has more clinical experience, but I've been in healthcare administration for over 20 years. I ran a small clinic, and so although I don't have the clinical expertise, I do have all of the other probably requirements that you're looking for in regards to knowing who to talk to and how to ensure that they understand the product. I also have a little bit of IT on the cybersecurity side, doing risk management framework. So even though I'm not clinical, would you look at someone like me to potentially fill that type of position?
I don't think so for this specific position that I was talking about on this call, but as we get more accounts, I think there's opportunities for kind of what I would call clinical operations type of functions and roles, which really come down to kind of logistics, operations, and planning, coordination, things of that nature. And as I mentioned earlier in the call, some version of that, depending on, the skill set, business development, top of funnel, early sales work potentially.
Okay, thank you. I appreciate it.
Yeah, thank you for the question. Sorry.
Are you looking for sales folks now, Andrew? Or early funnel folks now?
Yep. Yeah, that's one that we're still kind of trying to figure out what the right profile and job description is for what we're asking people to do in that function. But
Absolutely.
I think we would certainly lean to people who understand, how how hospitals work, how departments are set up, who those people are within those. Those are all really intangible, valuable assets when it comes to trying to navigate and operate within that environment. So those are huge bonuses and pluses for those types of positions. So I may add another job to the job board that I hadn't thought about just yet. So thanks to everyone on the call for enlightening me on the broad set of skills that exist within this group.
Yeah, absolutely. You said it perfectly, the broad set of skills in the group. And, obviously, I think you and I already spoke about this, but the student, the folks on this call, as they're transitioning out, they could start working as early as tomorrow, unpaid for 1, 2, 3, 4, or 5 months, while they get spun up in a sales role or HR, admin, whatever, anything that you guys really have. They have some unpaid time available to get trained. I don't know if there's the ability to take a healthcare administration type of person and get them a little bit more spun up on the clinical side of things. Just throwing some thoughts out there, but yeah, it's a pretty diverse group. So one of the things I really enjoy about it.
Yeah, understood. Great. I think it's an interesting point. Is we as a new company, we're figuring out how do we bring people in and train them up as quickly as possible too. So the better we get at that, the wider we can open our aperture in terms of the roles and people and skill sets that we could potentially train into roles we've got to be really good at training in order for that to get wider. And so that's something we're hopeful to be able to roll out the next few months and 3 to 6 months time frame, hopefully. So
what would you say, and just, if we need to, if we wrap up early, that's fine. We have the whole hour blocked if you want to stay with us, or however long the questioning goes. But out of my own curiosity, as a startup in the healthcare industry, what have been some of your biggest challenges getting this thing off the ground?
Oh boy, I don't know if we've got enough time for the rest of the call here, but the challenges go by stage. And so, when you invent a new technology, the first number of years was around technology development, regulatory clearance, clinical evidence generation. We manufacture and develop all of our own technology. So, all of those challenges are kind of technical challenges and engineering problems. And then if you transition over to introducing a new technology into hospitals is certainly one of the harder things that there is to do in terms of this space. So if you're a new vendor, new technology, a lot of education, a lot of awareness building. It's amazing and super rewarding when we find people that value and see the need for what we're doing. And then you've got a segment of the market or clinicians that maybe just weren't trained a certain way, or need time to catch up to the early adopters and innovators.
What would you say the best? And I'm sorry, I apologize if this is too deep, but my curiosity is, I just love what you guys are doing, right? Like, I think this is so cool to whenever you can improve something that was already existing, but you took and developed a technology that improves, I'd say, quality of life, really. But what would you say, like, the best feature of FlowPatch of this is? Like, is it the wireless? Is that what makes it so awesome, or is there something more important to you?
I mean, I what matters the most, like I said, it's like we put the patient at the center of everything we do. So if we think about our mission, our core values is like every decision we make, when we have a hard decision to make, or we always kind of come back, like, what's the best thing for the patient? And then one removed from that is, the users, the nurses. So, but what users say is that it's fast, easy to use, help me makes a better decision for the patient in front of me, and gives me confidence that I'm doing the best I can for that patient. And that's probably the most rewarding part of the job, is when we know that we helped make the right decision and we didn't send a patient to the ICU fluid overloaded and on a ventilator for 3 weeks, when we could have just not given them that extra liter or two of fluids, and they end up discharged the next day or 2 days later, and everything's fine, right? And that fork is really why we started the company, is that, like, fluid overload is a major problem in hospitals, and people used to look at it as a benign volume replacement, and they used to just give lots of fluids, and that has been proven to be very dangerous and not good for patients when they can't handle it. And so what we help do is make sure that the delivery of that IV fluids are a prescription drug, are delivered safely and effectively. It's like, if you were going to give someone antibiotics, you check to see if those antibiotics are working. You don't just keep giving people antibiotics that aren't working. So I think the fast, easy to use, wireless, those are all kind of great usability features. And then just the empowerment of end users to be able to have that additional capability that they didn't have before.
That is so cool. I have almost no medical training whatsoever to speak of. I did my 15 years in the Air Force was in cyber and IT and communications. But before I joined the Air Force, I worked in the emergency department at a hospital in New Hampshire doing patient transport. Sometimes outside of the emergency department. Sometimes it'd be like in the main part of the hospital. But I'd be with no knowledge, right? As a high school student, I'm transporting patients around the hospital with all these IVs and different things attached to the patients, and knowing nothing about what was in them, the flow, none of that stuff. So I see where this could definitely help in those times when a patient is not in the direct care of a medical professional.
Yeah, and
So I think it's awesome.
yeah, the other thing is too, is like the majority of technologies that are used for this stuff are invasive, right? So you're sticking something inside of someone. That's,
Right.
you know, anytime you can avoid putting a catheter into somebody to measure something, that's a good thing, right? It's better for the patient, less risk of complications. You know, take a complicated 20-30 minute procedure down to a minute, and it can be done by anybody. That's, you know, that's the beauty of it.
As we sort of wrap up, if anybody has any last questions for Andrew, go ahead and throw your hand up. We'll get those answered. And then this will be my last question. And I'll save it because it looks like Robert's got one for you. But go ahead, Robert.
So you mentioned the cybersecurity positions potentially coming online. Do you have like a guesstimate, I guess, for like doing the penetration testing or vulnerability assessment type of stuff?
Well, as a full-time position, not this year. Probably not for the next 12 months, unfortunately. The majority of the work is really around cybersecurity, IT risk assessments for hospitals. So those like questionnaires that hospitals make you fill out, but you know, more so working towards SOC 2 and ISO 27001. You know, those are more internal policies and best practice. So I know I didn't say that we're looking to spin up a cybersecurity role as much, but maybe for what it's worth, if you haven't given some consideration to, there are a lot of companies out there that need to the other side of it. There's companies that do these on medical device companies. So if you flip the script, instead of thinking about us as an employer, if you looked at some of the different third-party vendors that hospitals hire to perform the risk assessment on behalf of the institution on like a medical device company like ours, that might be another avenue for you to think about.
Yeah, for sure. Thank you.
Yeah, absolutely.
Interesting. And then I know I said I only had one more question, but I actually have two more. So 5 years from now, if we fast forward 5 years from now, are there any future plans to expand into different lines or different divisions or things like that with Flosonics? Or where do you see the company in 5 years?
Yeah, I mean there's we could be doing the same thing for the next 20 years. And it's such a large problem in a large market that there's lots of opportunity there, but adjacent to those things, expanding to different patient populations. So for example, in a lot of the partnerships we have with the DoD around trauma, combat casualty care, moving to pre-hospital EMS, trauma triage is the next logical expansion for us, I think.
That is so cool. And then for real, my last question would be, so for the 60 plus people on the call or whatever, as they're transitioning out of the military, getting into new roles on the civilian side, if you want to focus on healthcare, you can, but just in general, what would you say is like your number one piece of advice for these folks as they're transitioning out of the military and hitting the ground as in how to act or how to be or how to get kind of integrated into the civilian world? What would you give for advice?
Boy, that's a big one. I think, you know, some of the things that, you know, on the job hunt front, I think a lot of people that I've worked with always appreciate the active follow-up quickly with actionable next steps and, you know, some takeaway, do some pre-work and also, you know, take some next step. So, you know, show that initiative, follow up. Those ones, I think, you know, more on a personal note, I would, you know, try and say, well, find something that you're interested and passionate about in terms of industry sectors. Right now is probably been the best time ever for a lot of emerging startups and companies that are opening up, especially in the defense tech sector. I would, you know, the couple examples of things that I would do is I would go into you know, some of the recent venture funding stuff in different industries that maybe, so infosec cybersecurity. There's a lot of defense tech. The defense tech is quite a wide aperture of different use cases. So like there's air, drones, naval. There's lots of different startups that would be kind of like those small early stage companies that have traction, that have raised money, that have a compelling product, that kind of join fast paced innovative tech. An innovative company will give you the opportunity to do lots of stuff across many different you're going to gain 10 years of experience a lot faster at a startup than you will working for a big company. That's my general view. So if you want to get after it and you want to join a team and you're fungible skill set, you can be a T-shaped person to learn anything and make yourself useful. Go beyond the job description. And then I would, if I was targeting, I would be thinking about looking at those. Like I said, there's you usually find funding lists of companies that have recently raised capital or made big investments. Those companies are typically hiring like crazy because they got to put that money to work. The other places you could look at, for example, are graduate companies for a program called NATO DIANA, the Defense Innovation Accelerator Program. There's a lot of great companies that we went through that program. I think there's 75 companies per year that graduate that cohort, and those companies, from my experience, are all doing some pretty crazy innovative stuff. And those teams typically are 10 to 50 people, and to those would be sort of be targeted about where you want to work and why. And then if you can find a rocket ship, get on it. That's the old saying. If you can get a seat on the rocket ship, any which one, pick something you like doing, find people you like working with, and that would be my advice.
I did not know that you were going to bring that much, man. I really appreciate that. Like, that advice is the same advice that I find myself giving at least 5 times a week. And so I appreciate hearing it from another professional. Especially the part about, like a lot of folks that are transitioning out of the military, I'm not sure exactly what it is. I don't know if it's job security, if it's stability, if it's what they know, but they almost always gravitate towards these like big government contractors, Boeing, Lockheed Martin, all that stuff. And I'm like, I tell everyone that I bump into, like, hey guys, just so you know, there's 33 million other companies out there. And it's not that the big government contractors don't have amazing jobs, but it's like, there's companies like Flosonics out there. There's companies that are, that you guys kind of probably bump into on these calls that you might have never even thought of before. Like, who put a 1 in the chat if you even heard of Flosonics before Andrew joined us today, or before today. It's probably no one, right? And so that's what we encourage these students is find smaller, mid-sized company startups that are just getting venture capital and getting going, because they're the ones that are desperately looking to add talent to their teams. And you won't be fighting thousands of applicants. It's like you might be the only veteran applicant that a company gets all month or all year. So I love the quote about if you find a rocket ship, get on it. That's freaking awesome. I love that, man. So hey, Keaton, did you have a question before we let Andrew get back to his day? I don't know if he's still there, but he had his hand up for a minute. I think he had a jump. Dang, I should have called on him sooner, but all righty. Well, hey, Andrew, I really appreciate the time. I appreciate the advice for the students, and looking forward to getting some interest from some of our students. I saw that you're interested in a couple of them, so I'll reach out to those folks and connect them with you. But man, this is awesome. I love what you guys are doing at Flosonics. Looking forward to being more of a part of it, and have a great rest of your day, great weekend, and we'll be in touch, man. Thank you.
Sounds good. Thanks for everyone on the call. If you got any nursing or clinical people looking to transition into industry from even civilian medicine, please keep us in mind, and any referrals would be greatly appreciated. And Tyler, I assume that these calls happen. We get new batches and cohorts of people transitioning, so I'm not sure. We'll get with me after, and we can try and figure out how we can keep the evergreen cycle going for new people who come into the fold.
Yeah, absolutely. And there's actually Mondays through Thursdays, there's a lot more students on here. A lot of them are at a different call right now, but if you go back to 7eagle.com/mentor, you can find a Monday through Thursday slot that you have some availability. Come back and join us. There'll be 400 or 500 people on here. So,
Wow.
yeah. So yeah, if you want to, even if you wanted to do that, like, you know, in a week or two or next month, whatever works for you, we'd be happy to have you back.
Oh, geez. Okay, cool. I will, I'll put that in my calendar. Thanks a lot and appreciate everyone on here, and good luck on your search.